Hello everyone, my name is Dr. Sam Vine. I am an Associate Professor in Psychology at the University of Exeter, and I'm also a Director at Cineon Training. Now, the aim of this talk is to give you a brief introduction to the work that we've been doing using eye tracking to investigate the validity of a simulation. We use eye tracking technology to try to understand whether simulations are fit for purpose. Simulation is obviously a critical tool in helping trainees to learn and develop skills, and it's been widely adopted in a number of different industries. But whether you're a trainer or a trainee, a simulation developer, or a curator of a training curriculum, one important question you should always be asking yourself is whether the simulation that you're using or proposing is fit for purpose. Now, we have been exploring and developing theory in this area to try to bring together all the different concepts and factors that we think need to be considered when you are designing and testing a simulation. This has led to the proposal of the framework that you can see on this particular slide, and the proposal of a series of measurement tools that will help individuals to test the validity and the efficacy of their simulation tool. Now, we make reference to some of these on this slide around the fidelity in terms of physical, psychological, emotional, but also in terms of the pedagogical viability that the simulation has and the extent to which it improves learning outcomes. Now, one particular measurement tool that features very highly in our work is the use of eye tracking technology. Eye tracking, which is the use of cameras and infrared light to record the gaze behavior and the location of attention of different subjects, is used as a way to try and understand the extent to which simulation is reflective of the real-world task. So if we use eye tracking to understand the performance of the real-world task, we can subsequently use eye tracking to explore whether the simulation that was developed to reflect the real world is realistic and whether it's effective as a learning and training tool. Now, one example of this approach is our work in the field of surgery. In this 2014 study, we explore the efficacy of a surgical simulation that's used to simulate a TURP operation. The extent to which this simulator effectively simulates and models the real world was explored by asking a series of surgeons to perform the simulated procedure, followed by a real-world procedure with patients. On both of the occasions, the simulated and the real world, surgeons were wearing eye tracking technology that helped us to explore where they focused their attention and what they looked at. And you can see that in the video on the left-hand side. Now, what we identified is that there were some subtle differences in the way that surgeons used their eyes during the real world and the simulated procedure. And this allowed us to make some recommendations to the manufacturers of the simulation to improve the efficacy and the validity of that tool so that it better prepares surgeons for the complexities of the operating theatre. Another example comes from the field of sports. Here we compared one form of simulated training, which is the use of a putting green for practicing golf putting skills, with another form of simulation, the use of a virtual reality putting headset in which people are putting on a virtual green using an instrumented putter. Again, eye movements are recorded in both of these situations to explore the efficacy in comparison to one another. We found that eye movements and the gaze behavior of subjects after a period of learning and training were much the same in the virtual reality tool as they were in the real-world simulation. And so we were able to conclude that this kind of virtual reality tool, which doesn't require the expensive putting green, doesn't require lots of space, doesn't require a real golf ball, may be an effective way of preparing golfers for an up-and-coming competition or just a particularly stressful or difficult round of golf. And this approach is possible in a range of other real-world settings. We have adopted this approach in fields such as aviation, emergency medicine, Formula One, pit stop simulations, as well as civilian driving. Again, always adopting the approach of comparing the eye movements in the real world with the eye movements in the simulated world to try to understand the extent to which the simulation is realistic and is valid. And this has led to the development of simulators that are more effective at achieving the learning outcomes. Now, the examples given so far in surgery, sport, aviation, etc., all reflect a kind of retrospective approach, the utilization of eye tracking to retrospectively examine the efficacy and validity of the simulation tool. But it's also possible to do this in a slightly more proactive way and use eye tracking to inform the design process of the simulation tool so that what's designed and developed ends up being of high validity and high fidelity. So in this particular example in the oil industry, we explored eye tracking footage of real-world operators performing their tasks in the real environment in order to fully understand how those tasks are executed, what captures their eyes, what captures their attention, how do they perform skillfully in the real world. This information was then analysed and was used to guide the subsequent development of the tool that they used later for training. And this ensured that this tool was realistic, was high fidelity, and it encouraged the interactions that happen in this virtual tool to be similar, to be consistent with what happens in the real world. As a result, we've developed a tool that is helping the trainers of these operators to achieve their intending learning outcomes, which is hazard awareness, safety, and speed of learning. One example of a VR simulation tool that was made for the medical sector is through a recent collaboration with the Plymouth NHS Trust. We designed and developed a VR simulation of an MRI scanner. This was designed to help patients who are anxious about MRI scanning to experience the sights and the sounds of the scanner before arriving for their appointment. The tool has built-in functionality that enables us to monitor the anxiety levels of the subjects as they go through the VR experience. There's also a built-in biofeedback mechanism that coaches the subjects to be able to keep their heads still throughout the process of the scan. So just to summarize some take-home messages from this talk, we all agree that exploring the efficacy, validity, fidelity of simulation is important. We need to reflect on the extent to which simulators are fit for purpose. Psychological science and theory can help. Science has allowed us to understand what those factors are, and has proposed a series of measurement tools for being able to measure those factors and therefore judge the efficacy of the simulation. We believe that eye tracking provides a really insightful, really detailed, and really objective methodology for doing this, a way of being able to test the validity of simulation, both retrospectively, by looking back at simulators and judging them, but also proactively in terms of designing simulation based on eye tracking footage from the real world. I hope you found this interesting. Thanks for your time. Please get in touch if you have any questions. Thank you.